Hello again, everybody. You're all very welcome to today's Lunch and Learn series, which is being organised by the EU-CONEXUS Career Network. My name is Rebecca. I'm the Senior Project Officer for the Career Network. I always like to begin with a brief overview of what the Career Network is all about. Some of you may have heard this before, some of you may not be familiar. So the Career Network, we work in four main areas. One is we help in the development of job and internship career services for students, and we do this through our online careers platform, Job Teaser. We are also involved in the implementation of job readiness training. We do this through online events for students. Actually, our next student event will be taking place on April 9th on the topic of artificial intelligence and how it can support students' career journey from job searching to interview prep. We also support professional development through knowledge sharing and where we exchange ideas and best practices like our event today for staff. This is so we provide the best supports available to our EU-CONEXUS students via our staff. And you can now access the recordings from our past Lunch and Learn series presentations on our website. And finally, the Career Network is leading the planning and development of an EU-CONEXUS alumni network. So I'll share the details about Job Teaser, our upcoming student event, and our Lunch and Learn catalogue in the chat box shortly. But bringing things back to why we're here today. So I hope everybody is sitting upright, and if not, well, our speaker will hopefully help us with that today. We are all very happy to be joined by Mireia Yeste, who is a doctor of physiotherapy, professor at Universidad Católica, national judo team physiotherapist, and specialist in musculoskeletal and high performance sports physiotherapy. So just to note that today's event is being recorded and that the recording will be shared afterwards. A copy of the presentation slides will also be shared afterwards. If you have any questions, please submit them in the chat function. We'll do our best to go through them. We are also trying to gather some feedback about our Lunch and Learn series. So towards the end of the presentation, I'll ask you to share one tip or insight or key takeaway message that you got from today's event. And I'll remind you about this a little later on. So Mireia, thank you very much for joining us today. And I now hand over to you.
Okay, thank you very much. Welcome everyone to this presentation called Move Better and Feel Better. As you say, I'm Mireia Yeste and I want to start presenting myself. I am a doctor in physiotherapy. I'm a specialist in musculoskeletal disorders. I'm also a physio in the national team of judo in Spain. And actually, I've been working with sports physiotherapies in other disciplines from last 10 years, almost all my experience. But I'm teaching in the University Catholic in Valencia right now. And I just want to help you with some tips today. And I want to explain you the principal disorders for who works sitting or for who works a lot of time and long hours. And the goal of this session is to help you feel better and work better by making small practical adjustments to your posture and work habits. These are easy changes that can have a big impact on reducing discomfort, improving focus, and preventing injuries over the time, of course. Here is a quick overview of what we will cover in today's session. By the end of this session, you will have, or I hope so, a clear understanding of why these issues arise and, most importantly, practical strategies to prevent and manage them. And I hope so. Okay, let's start. Okay, I give you this question first. Why posture and ergonomics matter? Maybe some of you know, or maybe not, but the poor posture and lack of movement can lead with back pain. Another disorders as neck stiffness, wrist discomfort, or even chronic conditions like repetitive strain injuries. Some of you maybe feel sometimes in your life like back pain or neck pain, or maybe some of you have chronic disorders of this type of areas in your body. And I'm here to help you with this type of disorders. Some studies show that musculoskeletal disorders are one of the main reasons for lost productivity in the office workers. That's why it's important to focus on that. But the good news is small changes can make a big difference. With the right movements, stretches, and ergonomic tips, you can prevent this type of issues and feel more also energized. It's not only like body disorders, it's also mental health, to improve your mental health too. Because we know now that if you start your like working day with some pain, will be like worse in your mental health that if you try to start your day with some stretches, some movements, and with less pain. For your mental health will be easier and much better for your productivity too. Okay. Here in this slide, we can see the principal areas or the principal disorders and how they can impact in our body. And I also, under the picture, I put the impact of all of them. I will explain later. Let's explore the effects of prolonged desk work on our bodies. Many of us, as I said before, maybe experience spine issues from cervical pain or neck, or stiffness in the upper part of the back, or discomfort sometimes in the lower part of your back. But in addition, repetitive motions as working with your mouse in your work desk, also and static positions, can lead with wrist and hand problems such as carpal tunnel, tendinitis, and also pain or chronic pain in your hand. And also these disorders or these issues can not only cause only pain, it can be also chronic pain, and all of these can reduce like your overall productivity. And also we will talk about at the last part about burnout syndrome, okay? Just focus in the spine, wrist, and overall impact about the spine disorders, Several studies have documented that office workers experience a high prevalence of musculoskeletal issues. For example, in Spain, one of the main disorders for office workers is neck pain, lower back pain or discomfort, and shoulder and upper back issues. I think it's in the top 3. And also people can work sometimes because of these disorders or regarding these disorders. Is why it's important to prevent this type of injuries in the office, to help the office workers and the rest of the people with them. Is why this has a high impact in our environment. And also these findings clearly highlight that the spine is one of the most affected regions for who work long hours at a desk. In addition with that, talking about repetitive movements, we have also all of these numbers, percentages, are around Spain, okay? I'm focusing in this country, but also you have studies or researches in all the world, okay? But around 10-15% of the work office people, they experience carpal tunnels or such as a carpal tunnel syndrome, with around 10-15% touches. And this is also a high percentage for me, because if you do some changes in your environment, you can avoid this type of injuries, okay? If someone doesn't know what is carpal tunnel syndrome, basically is an impingement of the vascular and neural structures when they pass through the carpal tunnel, and the carpal tunnel is between the arm and the hand, okay? It's around this area. And sometimes because you don't have the good or the correct angle when you're working with your mouse, it can be like a pressure or increase of pressure in this area. Okay, is why we need to use, I will explain later, you can use some, in addictions, you can use some supports for your hand to improve the position of your hand when you are like working. Okay, but beyond the physical pain, no? As I said before, these musculoskeletal disorders have a major impact on productivity. That I know, no, that this is also a business, and for them, no, is also important our productivity, no. Some research indicates that chronic discomfort can lead with the reduction in work efficiency. With some studies estimate that productivity may drop around 20-30% among the affected workers. And this reduction is not only affect individual performance, has also no border in the economic impact on organizations. And again, in our mental health, it's not only about business and things like that. No, we have to also think about our health. And in the last part of this slide, no, we have this burnout syndrome, and this is another main syndrome, and with high impact in our day-to-day. Right now, I think nowadays is popular. Maybe you have heard about that, no, about burnout syndrome. This syndrome is defined as an emotional, exhausted, depression, and reduce of the sense of personal accomplishment resulting from chronic work stress. Okay, sometimes also stress is more common to be the cause than the consequence, but all of these symptoms it can lead with depression or reducing our mental health too. Prolonged desk hours with long hours sitting, few breaks, and continuous work pressure can significantly contribute to burnout syndrome. Okay, if you hear now about this syndrome, you know. We have some researchers that one of them, no, about from 2019, they found that around 23% employers in United States, this research is from United States, maybe because they work more hours than in Spain sometimes, but they report feelings of burnout. 23% of the, okay, is also a high percentage too. And around 40% of the workers, they experience burnout sometimes. But if you ask all of your partners in your work, maybe they experience just once for life in their life burnout syndrome. Okay, but maybe they doesn't know what is exactly. No, is why I'm trying to explain. You know, but it always depends about your environment, about your breaks, about your conditions, stress, pressure. All of these can also contribute to this burnout syndrome. But also we have an impact of, or if we have a sedentary behavior, no? We know that we are sometimes exhausted, no, because we spend a lot of time working, but we must do physical activity before or after, because this has a good consequences or high impact in our mental health, not only in our body. No, some people want to or prefer to do before work is always or is also good idea, but if you prefer to do after work is also good idea, but always move. No, we have to try to move. But all of this has been consequences in our productivity. No, burnout, as I said, is not just a personal health issue. It can also reduce around 20-30% our productivity as a chronic stress, physical discomfort, also can decrease your concentration and also your work performance. No, is why we need to also prevent that. And I will try to explain you some strategies today and some tips to avoid that, and if you feel that, to decrease this type of symptoms too. Okay, now let's try to review some common postural mistakes that many of us make during our workday. Maybe some of you will feel identify with some of these postural mistakes, no? I'm sorry, I need to drink some water sometimes. Okay, let's start first with the forward head posture, no? Maybe some of you recognize, which is this posture, no? Is when we have our head forward instead of aligning with our spine, no? We have the spine in this area, no? And if you have the head forward, no? We can call this posture as a forward head posture, no? As you can see here in the slide, we have the correct posture because we are not aligned, no, totally, but this will be the correct one and this will be the incorrect one, no? Also, after this one, we will see another type of postures, no, as slouching rounded shoulders or putting a stress in the upper back. But this type of postures is the common postural deviation and the common mistake posture that you can see of who work with desk or sitting a lot of time or using computer. But nowadays we can see in young people too, in students also, because they spend a lot of time with cervical flexion and also with the phones, no? That we know that we spend a lot of time in flexion always, no? Flexions of the anterior area of our thorax, cervical flexion, etc. If you think about it, how many time you spend in extension during your day? If you don't practice any physical activity, maybe the results will be nothing, none. You spend maybe 80% or 70%, despite of when you are sleepy, in flexion, no? Imagine that how can be stress your muscles of the anterior region of your thoracic cervical area. Okay, is why we need to improve also more movements about stretching or about doing extension of our spine. Okay, or try to also rest sometimes using your phone or computer, etc. We can see this condition frequently observed in individuals who spend, as I said, extended digital hours by using devices, or also who keep a lot of time or a lot of hours with sedentary lifestyle. Huh? For example, after the workday. I know that people sometimes feel tired, that they want to be in the sofa, but this increase this type of postural mistakes too. And also in the last or the few research, we can see that this position leads to an imbalance between the neck muscles and the extensors, because extensors become overreactive to the head, to support the head, while we can see the cervical flexors muscles weakness over the time. Is what we produce. We produce like a hypertonicity of our back muscles in the spine and weakness in our flexor muscles, okay? Especially deep muscles, because if you don't have to support your cervical spine in a correct position, then your deep flexor muscles will be weakness, okay? We have also a special exercise to focus in people with this type of postures, that this is more especially in the physiotherapy area. But I will explain you some exercise to improve the strengthening of these deep flexors muscles, okay? And also we can see this imbalance is not only increase the mechanical strain over the cervical spine, but we can also feel some variety of symptoms, such as chronic neck pain, tension sometimes in our upper trap muscles, shoulder muscles, but also can produce some headaches or cervical or chronic neck pain too. In some cases, this altered posture can even impact in breathing patterns, okay, by, for example, limiting the movement of the upper thorax, okay. I saw a lot of cases of people who spend a lot of time with a computer that they reduce a lot the mobility of the thorax. And then one of the goals with this type of patients in the treatment will be improving the mobility in the thoracic area, okay? And you can start doing that. You can start doing mobility exercises at work, also in your also desk. No, I will explain you that is possible, and you only need maybe 5 minutes for a day to improve your mobility, and this will reduce a lot your symptoms and can help you for long periods of time, okay. um, let's see another of the common postural mistakes. This is called slouching and rounded shoulders, but basically, no, is a postural deviation that we can see the upper back spine, thoracic area, with an of uh, increasing of the curvature of the thoracic spine. And this is how we can see the common postural mistake, and this is how supposed to be, no, or how supposed to be the normal position, no. If you see this position, maybe you are no imagining when you are working with your computer, sometimes maybe you don't think too much, but you are no reinforcing this posture. Is why it's important to do like small breaks to try to finish with these postures, no, and try to mobilize the thoracic area. And this condition also is typically develops due to prolonged periods of sitting, especially in ergonomical poor environments, which can lead also with significant muscle imbalance. And again, how we can see the muscles in this postural mistake. For example, we can see retraction of our anterior muscles. For example, we can see some retractions of our pectoral muscles, but also retractions of our neck muscles. And again, how we can see the back muscles. They are like totally stretched all the time. And imagine after long time or a lot of hours, a lot of minutes, a lot of months, if you stay with these muscles, especially the back ones, stretching all the time, you will feel like or will increase your back pain for sure a lot, okay? And for instance, no, the chest muscles often become over tight, while the muscles responsible for stabilize the shoulders, they are weak. Basically, you lose stabilization in all of these common postural mistakes. And the spine needs, like the muscles around the spine, they need to be with the perfect strengthening to keep your spine like stabilized and without any bone disorders or joint disorders. Is why sometimes people start with muscle pain, but after that, they start feeling some joint disorders, or they can affect in the spine, basically disorders as hernias, protrusions. No, these are like more acute or maybe worse, but you can start reducing the muscle imbalance to prevent or to avoid these bone or joint disorders. Okay, I don't want to make you like afraid a lot, no, but is I'm trying to help you or to think in the future, not only in the present. Okay, and And again, in some cases, these postural mistakes can affect to the respiratory function and limiting again the chest and the thoracic area with the mobility. We have some researchers and they emphasize the corrective intervention, such as ergonomic modification. Sometimes it's easy. You can do some modifications in your ergonomic environment to prevent that. But also we have a specific exercise routine that we will see, and with the aim or with the goal to strengthening the upper back and stretch the chest or the posterior part, okay? And all of these, the key to reverse these negative or adverse effects. For the last common postural mistakes, a mistake that maybe also you will be familiar with that too, is the incorrect position of the keyboard and mouse, okay? This is a typical mistakes, especially who doesn't think too much about the correct position, or maybe who doesn't know, no? When these devices are not properly aligned with the user's natural hand position, I mean, the position of our hand has to be neutral. We can see in the slide, no? This part of the slide in this picture is supposed to be the natural position of our hand. If your hand, when you're using your mouse, is like with lateral tilt, with hyperextension, hyperflexion, because it's too high, or sometimes because you are using your mouse in lateral position because you don't have like space enough in your table, then this type of pain, like wrist pain, hand pain, can like begin. Why? Because doesn't matter, for example, if you don't have like the correct position for 5 minutes, but when you have to spend 8 hours for a day, 10, imagine in 1 month, you can start compromise or increasing or impeachment the structures in your hand. And sometimes, like if you don't also practice physical activity and you don't have like a strengthening enough in your arms, it can be also, especially who has to do repetitive movements, it can be also an injury in the future, okay? But try to think about neutral position in your hand. Try to see if your like environment, it is okay or not, and if you have the properly devices. If not, try to use some supporters to keep your hand in neutral position, okay? Some researchers also indicate, no, that this misalignment can lead with repetitive strain injuries, and in this case, include this carpal tunnel syndrome, and also another injuries such as tendinitis. Why I repeat too many times about carpal syndrome? Because some people need surgery after the syndrome, and is one of the common ones. But of course, with properly treatment, physio, sometimes you can like avoid the surgery, you know. But this is one of the common disorders or pathologies with people who works with using a mouse, okay? And also this strain, it can be also as a chronic pain, and some people can feel symptoms as a numbness, okay? Like don't feeling the fingers correctly, also feelings with sensitivity in all the arm, okay? These are acute symptoms, but it can be also possible. And all of this decrease hand functionability over the time. And also this has an impact in your like daily life, not only at work, no? And we want to also life, no, after the working time, and especially who likes to paint or who likes to do something with their hands too. To mitigate this risk is essential to adopt strategies, ergonomic strategies, okay? Such as, for example, ensuring that the keyboard and again the mouse are positioned and appropriate the height and distance, and using wrist supports and taking also regular breaks throughout the day. This is too important, okay? Breaks, and again. Okay. What we have in this slide? In this slide, we have the ergonomic workspace setup. I give you time now to see this picture. This is like the perfect environment or the setup in your workspace, no? We can see here a human, no? Seems to be working, and how you suppose to be in your workspace, no? Like the optimal ergonomic, no? It's not just a trend, no? It's a key factor to reduce physical discomfort and also to improve your productivity. And again, mental health, okay? First of all, you need to position your monitor at the eye level, okay, E level, because you must keep your distance between a computer and your eyes in one line, okay? Imagine if you have your computer downwards or upwards, you will spend a lot of time in cervical flexion or extension. And we always want a neutral position. And the neutral position is easy to get if you have the computer at the properly height, okay? Also, or next, your chair should not only offer proper lumbar support, but also needs to keep your natural curvature of your spine, but also needs to be adjustable, so then your thighs remain parallel to the floor. Basically, we need to focus if our chair is comfortable for us, if we need or not a lumbar support. Also, you can buy a lumbar support. It's easy to get in Amazon. They are like a pillows that you can put in your chair, but also needs to be adjustable, okay, with the height, because some people needs to be higher, downwards, depends of their need, okay? Okay, additionally, arranging your keyboard and mouse. We need to keep our elbows, as we see in the picture here, with 90 degrees of flexion. Who is in the position with elbows in less than 90 or more than 90, they need to they need to do some changes in the environment, okay? We supposed to spend this time, and again, keeping the neutral or as much as possible position for our body. This angle, if you try to keep this angle, you can also reduce repetitive strain injuries, as I said before, such as this carpal tunnel or some tendinitis. Also, sometimes we can see also affections in the elbow injuries. Especially, maybe you have seen or you have heard about it, but especially tendinitis in the elbow, in the lateral part, we call as a tennis tendonitis or tennis elbows. Maybe you have heard about it, but sometimes this is because the repetitive movements. This happens sometimes, especially who start doing this type of job with repetitive movements, but this is also sometimes starts when you don't have this correct angle in your elbow, okay? Another thing that you need to be care is to keep your feet flat on the floor or on a foot rest. That maybe I have seen this action maybe more normally in the workspace environment. People start using this support, but if you don't have this type of support, then you need to keep the feet flat on the floor, okay? And basically it depends of your environment, you can use it or not, okay? But I think a lot of people start using that. Okay, another things that you cannot see in the, maybe here in the slide, but good lighting is another essential element. To have a good illumination and minimize the screen glare, not only reduce the eye fatigue, but also contribute to overall more comfortable working environment, okay? And also we have some options nowadays as using these glasses to reduce the blue light and things like that, but it is essential to have good illumination in your workspace and also good illumination in your computer. Try to do these changes if you don't have these tips present, okay? And finally, remember to incorporate regular movements breaks throughout your day, okay? Try to keep that in your mind. Even short periods of movement or stretching can significantly reduce the cumulative effects of prolonged sitting. A lot of research say that with breaks every 1 hour, 5 minutes can reduce significantly injuries and symptoms. By integrating all of these strategies into your workspace, you not only prevent discomfort, but also you create a healthier and more productive work environment. You will feel much better if you try to do these changes, okay? This afternoon, for example, try to see your environment and see if you use everything well, or if you can do some changes and start from today or from tomorrow to do this type of changes, okay? Okay, why movement is essential, no? Movement, I always tell this to the students, one of the first day, especially in the first course. Movement is the key to combating the negative effects of sitting all day. We need to move, no? We need to move to be alive. As you can read here, no? Movement is a medicine for creating change in a person's physical, emotion, and mental states, no? Try, if you don't practice physical activity, try to start doing 10 minutes before your working hours or after, and see how you're feeling, especially in the mental health. Why is important, no, to move? You can see, no, that move counters the effects of static positions. Another important point, improve circulation. With the movement, you improve the vascularization, especially lower limbs, because they are too static. When you are sitting, sometimes you are in a compression of your vascular arteries, venous, all of this system. You are doing a compression of this type of structures. And then with the movement, you improve the circularization, okay? And also you can avoid another type of disorders. And again, reduce rigidity and prevents pain. Then you must move, okay? I know that I'm telling you a lot of time about movement, but movement, and again, is the key, okay? Okay, an interesting also point in this slide, no? Dynamic breaks and daily movements. Sometimes I see people, no, they are with too pressure, with too stress, and they doesn't have any time to do these breaks. And it's essential to do that, okay? We need like incorporate these dynamic breaks in your day. Is essential. Like you can use, I will telling you some tips after, but you can use an alarm, for example, every 1 hour to remember, because people forget to do that, and you don't have to, okay? With the essential thing is to move every 30 minutes. I know though sometimes it's difficult to do that, no? Also happens with me sometimes, no, when I'm working with something about university, I need to be focused at least 1 hour, no? But every 1 hour, please move 5 minutes, do something, or use then your phone, but walking around. You must do not 10,000 steps for a day. You must do 20,000. We are thinking that 10,000 is okay, but no, 20,000 at least we need to move, okay? And there is also this rule, maybe you have heard about, but I think it's interesting too, the 20-20-20 rule, no? We have here in the slide the picture, no? Every 20 minutes, we need to look something 20 feet away or around 6 meters for 20 seconds. And then also you can use another alarm or a paper or something to remember that. Take a 20 seconds break. This is nothing. You don't have to move from your table. 20 seconds only, like watching or looking something 6 meters away, okay? This is helpful to reduce eyes like eyes fatigue, also to help you in your mental health, to reduce stress, to avoid like this type of pressures, okay? Try to start from today with this rule, okay? It is simple and you don't have to move from your workspace. Easy to do. If you have, for example, some like element around 6 meters away of you, try to think about this element and do this rule or practice this rule. Another thing that we can also do or we can start doing is simple mobility drills, as an ankle pumps or quick stretches. Okay, we will see later. But to do ankle pumps is also easy to start doing because you don't have to also move from your workspace. And it's basically doing movements about your ankle, like flexion, extension of your ankles. And this is also helpful and improve your vascularization, especially in your lower limbs, okay? I recommend you also to start doing. Let's see now some specific exercise to improve spine and posture health, okay? Maybe I will recommend you to do at the same time as me, at the same time that I can explain you, and then you can practice and see if you do well or not, and you can follow my indications, okay? First of all, one of the first, we have like basically 3 blocks, okay? One is about the spine, one is about cervical movements, and one is about arms and wrist movements, okay? There are like 3 exercises for each block. I think it's easy, okay? You must need maybe 5 minutes to practice all of them. The first of these exercises, thoracic extensions, okay? You must sit in your chair. It's easy to do because you don't have to move again. Or also you can do maybe standing, okay? You might place your hands behind your head, okay? Basically here. And then gently you have to arc your upper back over the chair's back. You also can look to the upper part of your work environment, okay? Like this. It's important to try to open your chest, okay, when you practice this exercise. I must recommend you to do this exercise 10 times. Every exercise 10 times is enough, okay? The second one is called seated spinal twist. While we are sitting upright, we have to twist our upper body to each side to increase the mobility in our thoracic spine. We can also help us like putting our hands like over the chair and then keep the position. We have to look right side and left side. This is helpful to improve mobility in the thoracic area, but also you do some stretches in your back muscles too. The finally of this block exercise, cat-cow stretch. Why is called cat-cow? Because it's like a simulation of cat and cow, okay? Also, you are sitting or standing, whatever you want, and you perform when you inhalate, or you produce an inhalation, and then you're arcing your back as a count, okay? When we inhalate, then we put our heads backwards, and also we produce a curvature of our spine. When we exhalate, then we perform the opposite position, then heads forwards, and we increase the curvature in the thoracic area again, okay? It's like cat, camel, or cat, cow, or cat, camel also, we can call it. 10 times, okay? All of this exercise, the target or the key is the spine, decrease the spine stiffness and increase the spine mobility, okay? But also we have, I will show you a video that's me doing this type of exercises, okay? And I will try to share with all of you today to save and use whatever you want, and remember how you can do all of this exercise. Second block, neck and shoulder exercises, okay? And now we are focusing in upper body, and we will start with chin tuck exercise, no? This exercise is interesting because it's good way to improve the strengthening of the deep flexors muscles. If you remember about before, I was talking about the forward posture. This exercise is to try to decrease this type of mistakes, okay? And also improve your spine posture. We have to gently pull our, I'm gonna try to put like this, to pull our chin backwards to engage deep the strengthening of the deep neck muscles. We can keep in this position around 3 seconds and then relax, okay? Again, relax, okay? This is called chin tucks. Easy, again, to do, and so helpful. Scapular retractions. This is also easy to do. You can do again sitting or stand up. Basically, you need to produce a scapular retraction. The meaning of that is to decrease the distance between them, okay? Squeeze your shoulder blades together, and this is to reinforce the proper shoulder alignments. Remember, you are in flexion all day, is why you need to focus doing these scapular retractions. You only can practice with your arms straight and doing like this, okay? You have to think like that you have a pencil between your scapulas and you need to get it, okay, between them. This is also a good exercise. And finally, it's good to perform upper trap stretch to alleviate, decrease tension in especially neck and shoulders. And we need to apply our head and then apply some pressure with our hand to release the tension in the neck and shoulders. We can do one side or another, okay? Like this. Last block, wrist and hand exercise. The first of one, because it's important also to move our hands and wrists to avoid these repetitive injuries. First of all, we have the wrist flexor and extensor stretches. We need to extend our arm like this in this position and use the opposite hand to produce an extension of our flexors muscles. And then we have to keep in this position around 10 seconds, okay? We can do with one hand and the another, okay? You also can do that like this, okay? Standing and using your table. I also recommend you to do the opposite one, like this and this, okay? To stretch the extensors muscles, okay? It's a good idea to do both, but especially flexors normally are strong and you're using more than extensors. Is why we're focusing in extensors, in flexors, sorry. The second one, this exercise is called tendon glides and is to increase the mobility of our tendons through the canals in our hand. Why is it important? Because sometimes using too many times as a repetitive movements, and then is one when the impingement starts in our hand. Basically, this exercise consists in trying to do first, for example, only flexion of our fingers, like this, and then using flexion of our phalanges, and finally using all our hand doing a totally flexion, okay? Basically, is to try to manage as much as possible the gliding of our tendons inside our hand. This can be more difficult, but try it. It's easy to do, and you will see that with the time you will see or you will feel much better. And finally, we have the grip strengthening. Basically, I don't have any ball with me now, but basically, well, I have an orange. It could be also useful. But basically, you can like buy these soft balls that you can get everywhere. These stress balls, and you have to like keep your grip strengthening or increasing the pressure to your ball, and this is preventing the, for example, hand fatigue, and also this is helpful for mental health and to reduce the stress. Okay, and this is easy, and to get a ball and to have a ball in your work environment is also easy to do. Okay, until here the exercises. Okay, I recommend you to do 10 times for each movement, and if you try to see how long you spend doing that, it will be less than 5 minutes. Okay, I recommend you, for example, in one of your breaks during your day, to do all of this. Okay, here we have some like practical tips to integrate in your daily routine for your better work wellness. Okay, first, set reminders on your phone, on your computer, alarms, okay, to encourage regular movements. Next, adjust your workplace as needs, okay? Do the changings you need throughout the day, okay? Try to sit always, keeping your position or your alignment in your position. Don't work like this, okay, with rotations. And finally, if you have an option, alternate between sitting and standing to reduce the static positions. It will be a great idea that we know that we have a table. I have a picture in the next slide in this one. This is the popular now tables. Maybe you have seen before. You can work standing or sitting. This is the best idea. Some people also use a treadmill like under this table. This is also a good idea if you have the option, of course, in your work, no? That we know that sometimes we don't have the option. We only have these tables and we cannot do any changes. But if you can, do it, okay? To sum up, okay, remember that posture isn't static, it's dynamic always. We are always in dynamic movements, but constant, small adjustments can make a big difference in how you feel. An ergonomic space combined with regular movement and target exercise can greatly reduce the risk of chronic pain and enhance productivity. Okay, these key takeaways and simple but powerful strategies for improving your daily work life. Remember that. Now I would like to share a video. One moment, like this. Now I would like to share a video I have created with a series of simple exercises that you can do at your desk. Okay, these exercises are designed to improve your posture and relieve tension and helping with combat the effects of prolonged sitting. And I recommend you to do, if you want to count with time, 30 seconds, taking 15 seconds rest, and do 2 or 3 times the circuit. If you prefer to do repetitions, 10, 15 times, 2 sets. And for static stretches, around 15, 30 seconds each side, okay? Easy to do. If you want, let's take a moment to watch the video together, okay? I don't know if you can also hear, or because there is a sound, but if not, I will share with you and you can send them. One moment.
Yeah, we can't. I don't think we'll be able to hear, but if you want, Maria, you can share the actual link with me, and I can include it in the notes afterwards. Yeah, but we can see it. Yeah, yeah. Thank you.
Perfect. These are the chin tucks. Some of these exercises have more characteristics, but if you want to implement, it's okay. If not, the simple ones will be okay. As you see, I'm doing in my sitting work, in my workspace. It's possible to do everything. Eh? This is pectoral stretches too, to avoid these shoulders forwards. I also recommend you to do 10 squats for a day, okay? Is another way to move. This is a tendon glides exercise. Okay, thank you for your attention. I would like to hear from you. And if you have any questions, I will be here to clarify any points. And thank you very much.
Super, Maria. Thank you so much. Very, very interesting. There's lots of maybe scared us with a couple of the tips, the 20,000 people are like, uh-oh.
I don't want to scare anyone.
I know. But I think some things will resonate more with others, that it's when you'll take it and you'll try it and go, yeah, I like this and I'll do this. The video is very helpful because I think actually that's something you could play on your screen and you could do along with you, that like a mini workout stretch video, so I think that's actually very useful, that we'll share afterwards. And yeah, the 20-20-20 rule as well, that kind of resonates with people too, as something very simple, quick, easy to do. The main takeaway I think is to make it regular and short. That I guess if you're sitting a long time, that you try to balance that with making sure that you are at least moving for a little bit, 5 minutes, or just do something after sitting for an extended period of time, to try to take the regular breaks. And I think as well, the like you make the point at the beginning that these are small, easy changes that can have a big impact, and maybe we don't realize that as a consequence, the small things that we are not doing have an accumulation, that they're actually having the negative impact over time. So it's just trying to be conscious of that, even something simple as having your keyboard too high or your mouse too high can actually have a long impact, or a negative impact in the longer term, So it's making those simple corrections can actually have a great positive impact.
Yes.
I don't know if we have any questions, but just some great just expressing their thanks to you for your sharing your knowledge. And I think there'll be competition now at people's desks, who can be the most mobile as well. But even from a practical point of view, you're making a cup of tea, or you're waiting for the coffee to pour at your 11 o'clock break. For me, that's going to be a starting point. Even if I just make a conscious effort, every time I make a cup of tea, I'm going to do some sort of stretch, and just small steps, and see how we go.
I also recommend you, maybe you can do, for example, of your parents together, some exercise before your working time. Because I had the opportunity to work for some big company as a physio, doing treatments, but also trying to do some changes in their workspace and their working they like start doing this like without me. They like making a time like at 9 or 10, and everyone doing the same time all the exercise. And I think it's a good idea also.
Very good. Yeah, like the buddy system or like a community that everybody is trying, because you may feel a bit silly starting if it's by yourself, but
Yes.
like that if you have you on the video doing it with you or doing it with other people in the office, it might be more encouraging to try it and maybe keep it up, because like you made at the very beginning, we don't realize the impact that it can have. And I didn't make the connection with burnout, but it completely makes sense that if you're in discomfort or pain as a result of, in part due to your posture or your sitting or your positioning, of course that's going to influence your productivity, how you feel, and just in general, like your mental health, So very, very really liked how you made that connection then too. So yeah, so just in the interest of time, just thank you so much for giving your time, and thank you as well to our audience members as well for attending. I've just put it lastly in the chat there that if you did like today's event, our next event, the date for your diary is April 8th. We'll be discussing something completely different, which is artificial intelligence and the literacy in higher education. So what might go wrong in terms of policies, competencies, and so if you're interested in that topic as well, so in between your exercises and your stretching, to check that one out and sign up for it. But yeah, really, thank you so much again for your time, and really, really enjoyed the presentation and lots of takeaways. Thank you so much.
Thank you very much for your time too. Thank you everyone to hear about me. Bye.
Super.